Okay, our next speaker is Shady Sedhom from Roche Pharmaceuticals, who's going to be providing an update on the Alabat study, which is in a phase 2A trial in Angelman syndrome. Shady?
Okay, good. Thank you, Ryan. Thank you for inviting me here to share with you updates about our programs, the Alabat program, ALDEBARAN study, and Reg-nuren, which is Angelman study. I met already many of you, but for those who don't know me, I'm a Global Patient Partnership Director working for Roche with focus in neurodevelopmental disorders. And those are my disclaimers. So I would like to start with Alabat and answering the question why Alabat is tested for patients with deletion. And just quickly to go through this, that's the old slides, I believe. Okay. Okay, so as you know that Angelman syndrome is happen in chromosome 15q, and if we look at the typical individual chromosome 15, you see that, sorry, this is the old slide, so I need to, so if this is the typical individual chromosome 15q, you see the mutation patients here are missing gene or having defect gene in the UBE3A part, while the deletion patients, they have longer missing genes, which includes what is called GABR gene here. And the GABR genes are those genes responsible for creating the GABA receptors. So the question now is why GABA receptors are important. If we look at our brain, it consists of many cells, which calls neuron, and those neurons connected to each other and communicating to each other, if we can say it so, through what is called synapses. And this synapses, they communicate by having what is called neurotransmitter getting to the receptor, and among those important receptor is the GABA receptor. So GABA alpha 5 receptors may contribute to greater clinical severity in Angelman syndrome deletion, and we know this from different studies before. GABA alpha 5 receptors, among the GABA alpha GABA receptors, what is called GABA alpha 5 receptors, and decreasing these receptors in deletion Angelman patients may cause severity of the different domains. So the hypothesis here is that while correcting UBE3A loss is essential for the treatment of all Angelman syndrome genotypes, a therapy selectively enhancing GABA alpha 5 receptor function may improve some of the symptomatology and potentially aid brain development in Angelman syndrome deletion genotypes. So Alabat, which is an oral tablet, having the potential to selectively enhance the GABA alpha receptor functions, which then help potentially the DUP15q, the Angelman deletion patients. As I said, it's oral tablet. It is already tested in healthy volunteers. It is currently tested in ASD patients, autism spectrum patients, and Alabat is so far up to date showed safety profile. And here in this small cartoon, you see where the Alabat binds to the gene, to the receptor, and how it is improving the function of the receptor. So ALDEBARAN, which is the study studying Alabat in deletion patient. It's phase 2 trial. We tested it phase 1 in healthy volunteers, so we are moving directly to phase 2. It's open label, so no placebo. All the trial participants will receive the Alabat, and we are looking into 56 patients from age 5 to 11, to the 17s, male and female, deletion genotype. We hope to activate around 20 sites in 6 countries. Many of those sites already activated. First patient was recruited in July this year. We hope to recruit more soon. So ALDEBARAN study objectives are first safety. It is tested in healthy volunteers, and it is currently tested in autism spectrum patients, but it is also important to test its safety on Angelman deletion patients. Also pharmacokinetics, like what does the body do to the drug. EEG, we talked a lot about the EEG effect in the last couple of days, and also some exploratory effects. The study is a short study. It starts with up to 6 weeks a screening period, followed by 12 weeks of treatment, and then ends with 6 weeks follow-up. It is including 3 to 5 clinic visits, maximum 2 home visits if this is allowed by the local regulations, and 2 EEGs, approximately 30 minutes each, one at the beginning and one at the end to measure the effects. So as a summary, it is already started, ALDEBARAN. It is a phase 2 study to deletion Angelman patients. And if you would like to discuss more, or if you have any questions, please feel free to talk to your doctors. More information are also available in clinicaltrial.gov. I would like to acknowledge also the team working on Alabat, who extended this to Angelman. Doing 2 studies with 1 drug is double the work, so I would like to thank them. Shifting gear to Reg-nuren, in the last couple of months, we had extensive discussion with interested companies. They looked into the data a couple of times, and currently, we have some interested companies who we are finalizing the discussion with them. We hope to get to contracting and finalizing the deal soon, which actually allowing the opportunity of extending the deadline, which we mentioned before or communicated before about the last dose in February, and then the 3 months visit or follow-up ending in May. That's potentially can extend. We cannot promise anything until things approved and signed, but we will keep you updated once we have more information, hopefully by the end of this year or early next year. With this, I would like to thank you all. I would like also to thank the trial participants who were with us on this journey, our PIs, all the sites, the staff who worked hard on both studies. And happy to take any questions at the end. Yeah.